It wasn't. Here we go. Okay. Okay, Linda. Hi, this is Linda Schofield, and Linda, you've been a patient here at the clinic for how long now?
Since April, and I was referred by an MD, Dr. Garcia.
Great.
I actually had gone to another chiropractor and had been going to one, and he said he wouldn't work on me anymore because he felt I was going to have a heart attack. So he sent me to a doctor.
Wow.
And he sent me to, he said he wouldn't touch me again unless I saw an MD and had an EKG. So I went right out to Dr. Garcia, and he looked me over. He did an EKG. It was normal. And he said, look, I'm going to send you to somebody. You just need to be adjusted. So he sent me to Dr. Brad McHenry.
And that's me, yes?
Yes, that's you. And you took x-rays, and you really talked to me and did a great consultation, and I felt very comfortable.
Well, thank you.
And then I came in the next day, and, we worked a little bit. You worked on me a little bit. And, you talked to me about the atlas and the axis, and my atlas and axis were not together on straight up and down like they should be in alignment.
And what problems had you had before you came in?
Well, before when I came in, I'd had chest pains. That's what I was seeing the other doctor for. But I was tired. I was overweight. And I just was having neck pains all the time. So that's how I ended up seeing you.
And you had other chiropractic care.
I had long-term chiropractic care.
And you mentioned the atlas and this upper cervical work, so this was a different type of adjustment for you. And
Totally.
how did that work for you?
Well, the first time, he adjusted me, was that the first time that it was really? It popped right into place. It was the first time I was just amazed, because it was the first time that I could actually see around. Like in about 30 years, I'd gotten just so used to looking, a little bit that way, and I could look around that way, but I couldn't look that way, but I haven't gotten so used to it that I wasn't paying attention.
And you had also mentioned a couple other things to me that happened after you started treatment, that actually you were able to start to lose weight easier, and that had been an issue before. Absolutely.
I started to lose weight a little bit. One of the major things for me was my eye had ran. I had some little eyelid surgery, and ever since I'd had that eyelid surgery, my eye was running, just my left eye. And I'd had the activator method. I'd had several adjustments, but my eye just was running all the time. And I was gone to an ophthalmologist, and he said, well, you have a dry eye. Okay. So you need to put drops in it. So I had been, but nothing seemed to help. And then that very first major adjustment, that stopped that eye running.
That's awesome, Linda.
So now I know when my eye starts running, I know my neck's out.
Well, I'm so glad Dr. Garcia referred you here. And Linda, thank you for your story.
Absolutely. Well, I would like to say one more thing.
Yes.
And that is that Dr. Garcia knows a good chiropractor when he sees one. And you're different, you're totally very careful with your patients, and you make people feel you want them to understand what's going on with them, so that they do learn and will take care of themselves and realize that you do need to, these subluxations, you do need to get them handled to have a better life.
Thank you so much, Linda.
Thank you.